Hey guys, so welcome back to my channel. I was gonna make this into a short, but then I decided, you know what, I'm probably gonna talk longer than a few minutes. So I decided that I just thought I'd make a regular video about it. Hold on, my glasses are so like, ugh, they're like glaring. Anyways, so I had been dealing with a lot of like headaches over the years, amongst other health issues I've been dealing with. But this was one of the classic things I've been doing from the very beginning. I've been still struggling with it. And I would love to finally find either a cure or a managed plan or something that I can just like totally like mark off the list. So, well, apparently, so I tried everything over the counter of the sun with dealing with migraines. I have, and my migraines are horrible. I get the little zigzaggy up my peripheral vision. I guess it's called an aura or something like that. I also get sometimes I get ocular ones where like literally I lose vision. I goes completely black for a few seconds or a minute or something like that in one eye, and then it follows up with a horrible head pain. I get a lot of sinus pressure ones and tension ones, especially since I have my teeth removed, at least the top ones. See, my top ones are removed. If you follow my dental journey one, you'll know all that aspect. Since I had those removed, I ended up getting, I think I get more tension up in here and as well as across my forehead and right in here. I don't really get ear pain that much, which is weird. I get a lot of like neck pain as well in the back of my head, all across this like back region. Every once in a while, I get a like what I don't want to call it like a zap, but it's almost like an electrical shock every now and then. Like it shoots like the top part of my head. So, anyways, but so I am really getting kind of nervous because my doctor put me on Ammovig, which seems to be the only thing that has really worked pretty well. The only problem with that, it doesn't last the whole entire month. I take it. Now, my neurologist said, you know what? That's common. A lot of my patients have mentioned that. But I'm like, well, is there anything else I can take? Well, I can take other medications on top of it to help, make it stretch a little longer. But those other medications really mess with me. They mess with my blood pressure. Now I have POTS, so that really does not help much. I'm trying not to keep it. I don't want it to drop. I want my blood pressure to raise a little bit because I deal with a lot of low blood pressure. Even though my blood pressure numbers are typically normal, they're normal to low normal. Every once in a while, I'll get a spike when they're like in the 200s, and then like a few minutes later, drops, and I feel that effect. And it's like a good roller coaster. That's one of the other issues I deal with, and that's a whole other video itself because I'm going to wait until after I go to the doctors and figure all that out. And that really won't be for another couple more months video. And I'll let you know how that journey of things goes if you're interested. But right now I'm getting kind of nervous because I have an appointment through my neurologist at the same building, but in a different area of the building. But they kind of work together. My neurologist, we did an MRIs, fine. I did 2 EEGs. Now, EEGs are basically kind of like they have these things, they hook it up all over your head. Doesn't hurt or anything like that. They just read your brain waves. You just have it on there and you just deal. You know what I mean? You don't have any pain or anything like that throughout the process. It's just annoying because you have wires on you sometimes. But typically, EEGs are done in the office and you can do them within 20, 30 minutes and then they're good. Well, mine had a little bit of slowing in the right side of my brain, but the doctor was like, it doesn't make sense because my MRI is normal. So he wanted to do another one just in case there was some issues there. So we did another one, but this one was a longer one. It was actually like almost a 2-day long one. I went in that morning and it took them about almost 45 minutes to put everything on my head, wrap my head. I just like look like a turban kind of style thing all over my head. And my daughter said it looked like I just had brain surgery because I had my head all wrapped up and then I had wires coming out, and then I had to wear this little device thing, like a purse monitor thing. And it was just to keep the wires hooked to it. And then I just kind of Anytime I had feelings of like I was going to pass out or weird feelings and stuff like that, that seems odd, I would push a button and it would record those, even though it's recording constantly, but it helps the doctors go through the whole thing a lot faster. It will just highlight these areas that I pushed. And then they can look before and after during that time, what was happening. And then I kept a log sheet and write down what was I doing during the time when I pushed that button, what was going on, how long did it last, whatever. And since all my episodes of feeling like I'm going to pass out, things like that, were happening very randomly. My hair is like a hot mess today. But even though it was happening kind of randomly, I ended up just writing a note on the thing. I'm like, hey, I pushed the button. It looked like I pushed the button like 20 times in the last hour because it was coming and going. It was like I had these symptoms and then I was okay. And then like 10, 20 minutes later, I have another episode. And I had to do this for 24, 48 hours. So like I went on a Thursday, got the stuff put on, and I brought it back on Friday. I think I did bring it. That was like 24 hours. I think it was only 24 hours. So I brought it back, the next day or so. And then they just look over it and then they let me know my results, within the next week. And then, yeah. So anyways, that result was fine. Everything was good. They couldn't find nothing there. So all my issues that's happening as far as my feeling of passing out and stuff is not neurological. It is got to be more cardiological. So that's what we're thinking. So that's why I've also been going to the cardiologist and stuff. But anyway, but I did the EEGs, headaches wise. They didn't see anything, anatomically what's causing the migraines. So we now figure out it could be some nerves, some weird things like that happening. And we couldn't figure out why I'm not responding very well to either the over-the-counter medicine or prescription medicines. And so we decided the only one I just find okay with is Amyovig, which is just an injection shot you give yourself once a month, and I'm good. Problem is, though, during the first month or two, I was good, and then month 3, it didn't last that long. It started tapering, getting, like, what's the point of giving the shot? It's only lasted me a week, or 2 weeks at most. And so my doctor decided, okay, what the next step would probably be is for me to try out Botox. I'm kind of scared about Botox. So this is what this video is kind of about. I am kind of nervous about it. I am supposed to go for my consultation tomorrow. And I've been doing a lot of research online about how is it, how does it work? Where do they put the needles all over you? I've been going through, all these, I've read all the horror stories on Reddit, and I have also heard nothing but good stuff as well. So it's like, I don't know. So it's supposed to be a consultation tomorrow, but my past history, every time I went to a doctor to get a consultation, most of the time, I don't leave that consultation not receiving some kind of treatment. So it's very rare that I have a consultation and not get a treatment. That sounds weird, but yeah. So I am looking forward to this appointment tomorrow, but I'm super kind of nervous about it. Now, I'll probably post an update video, like a quick update video, later on, probably the end of the week sometime or whatever, probably on Thursday, I guess, Thursday or Friday, and to let you guys know how everything's going and if I got it. So I'm really nervous, guys. If you've ever had Botox, for headaches, migraines, comment down below, put my mind at ease, please, or tell me, or at least be honest with me. Tell me, was it scary? Does it hurt? I haven't been given a lot of information about it direct from the doctor himself. So I guess that's the point of the consultation. But I heard that the needle pricks, I'm not bad with needles. It doesn't really bother me. Needles they're not horrible to me. But the pricking of the needle, I'm fine with that. I have a high pain tolerance. I'm okay with that. It's just more of the constant, like I heard that the appointment goes pretty fast. Once you start doing them, it's about 10 to 20 minutes to do the actual pricking, I guess, and then you're usually pretty good. And you can return, you immediately can go back to normal activities. You can drive, you can do whatever, which is actually good. There's not really much downtime at all. I did hear that sometimes you can have redness or swelling because it is anytime you're actually poking into the skin, you can't get it. It's like when you get a shot, sometimes you get sore, redness, swelling, or whatever. So you might want to apply like some ice or use an ice pack on your head or wherever you got the injections at over the next 24 hours. It kind of helps alleviate some of that pain or anything like that you may have residually from as a reaction to the actual shots. I also heard that first 24 hours is usually the most crucial time because, especially when you get your first dosage, because your body's never had it in its system. So you may have a headache. You may have the really, really bad headache for the first 24 hours. And then over the next week or 2 weeks or something like that, your headache should get less and less and less to the point that even the intensity should be very less. And after the first month, 2 months, you should have realized that you're not really having many headaches. You're not going through the whole migraine, bouts of being in pain and bright sensitivity, sound sensitivity, nausea, dizziness, all that stuff. So people say that getting the Botox, all the side effects of Botox are well worth it compared to having migraines. This is another reason why they say people that get Botox, they want you to be able to have all these horrible migraines at least half of the month. Because if you've had migraines almost 15 days or more out of the month, it's debilitating. It's painful. It's ridiculous. You're missing out. It's frustrating. It exacerbates a lot of other issues if you have other health issues on top of it. And it's just, you get to the point where you get very frustrated, and then you also get depressed because you're not able to go out and function and do other things like everybody else does. And you kind of want to, but then you're thinking, well, I don't want to because what if suddenly the bright lights bother me? Or what if I suddenly get a random panic attack, migraine attack. Migraine attacks are like panic attacks. They just happen. But anyway, so, yeah. But so honestly, I think that, I think everything's going to go okay. I'm nervous about it, but it is what it is. I'm thinking I'm going to go ahead and just situate my feelings tonight and just go to the consultation. What harm can happen? If anything does happen 1 month appointment, I mean, at least I'm around doctors and there's hospitals always. So if I do have a reaction later on or I have issues later on with this, I can always just go to the ER. My husband can tell them, hey, this is what she had done, and hopefully they can help me. I guess I gotta trust the medical system. It's really hard though nowadays because you don't know. I mean, and a lot of people say, it's sad that sometimes doctors, when they're promoting certain medications because they're thinking they're getting a payout from it, they really don't well inform the patient of all the bad things that can happen, or they don't sit there and say, hey, you know what, even though this is a great medication, even though it could probably help you, it's probably going to do more harm for you than help you because you have these other issues. So this is probably the extent of what we can do. You just kind of have to live your life this way. Unless you yourself, and you sign a waiver, you're willing to take that risk. But apparently that hasn't happened to me yet, so let's hope for the best. Maybe I'm just stressing and nervous about nothing. I don't know. So anyways, I will keep you guys posted if you're interested on how that works out, especially if you've had migraines and you're nervous about getting something like this done and you're just curious about it. Let me know. Comment down below if you've had it done, especially if you have POTS and you got this done, or you have some kind of autoimmune disorder and you had Botox done, particularly for the head or migraines. Let me know down below because I'm curious on how the outcome was, and now I'm curious also how everything turned out for you. Yeah. So I guess that's it for today. I just wanted to touch base with you guys, let you guys know that I'm nervous about tomorrow, but I think it'll work out fine. I think I'll be okay. I've given birth to a kid before, so I think this is nothing. So, that everybody compares that to giving birth. So, I am hoping that it'll go smoothly. My appointment will be fine. I will be fine, and I'm not going to be as anxious or nervous or anything like that. Because Lord knows that we do not need a panic attack in the middle of getting poked in the head. That would be horrible. So I'm going to try to keep my mind at ease, breathe, and we'll get through it. So with that, guys, I hope you guys have a great day, and I hope you guys have a wonderful week ahead. Again, I will probably post an update probably later on in the week, towards the end of this week, and so you guys let you know if I got it done, and if I did, and how I'm feeling, and how if anything happened from it. So, yeah, I'm not expecting miracles, but I'm hoping that it'd be better than what I've been dealing with. So, yeah, I guess so. I guess you guys have a great day, and please make sure you subscribe, stay tuned, and give me a thumbs up, please, if you like these type of videos of me and my medical journeys and stuff like that, so I know to maybe just kind of start talking more about that stuff than other things. So, and yeah. Also, share my videos, because you never know. Somebody else may be going through some similar issues. Even if it doesn't resonate with you, they may need somebody to listen to, and may enjoy knowing that somebody else is going through something similar as they are, and that they can always talk to somebody as well. Because I'm always here for you guys. I always comment. I always respond to you guys. And check out my other socials. I think they're somewhere on my YouTube channel. Check those out. And stay tuned. Hit the notification bell so you know the updates on all my videos. And I will see you guys soon. Bye.